8:45 here at 55 KRCD Talk Station. Bet you didn't know it, but you know it now. It is Cervical Cancer Awareness Month, and in studio from my cancer specialist, OHC, and they could be yours too. I hate it if you get a cancer diagnosis, but if you do, you should do what I did and just turn to OHC. Find them online, learn more at ohcare.com, or call 800-649-4800, and you may be under the care of my guest in studio today, Dr. Ajit Gubbi. Dr. Gubbi, it's great to see you today.
Brian, thank you very much for having me, and thank you to your listeners for having us on.
Oh, listen, I thoroughly enjoy these conversations. They're very enlightening. And, of course, you know I have a extra special connection with cancer, sadly. But I've learned a lot over the years from talking with the OHC folks across all areas of cancer. And one thing that I've learned is cervical cancer, and we'll talk in depth about this, but HPV, human papillomavirus, can equal cervical cancer. There is a direct line correlation between HPV and cervical cancer in women.
That is absolutely correct. So HPV is highly associated with cervical cancer. 90% of cervical cancers are associated with HPV, but that does not mean that just because you have the virus that you will develop cancer. But it is something that we watch very closely for, and that's why screening, annual follow-ups are just absolutely paramount.
Well, and from what I know, and I've read, and I went back the last time you were scheduled to be on the program, I looked it up. Pretty much everybody's got HPV.
85% of sexually active partners have HPV. It is think of it like the chickenpox virus. At some point, as long as you've been sexually active, you very likely have HPV unless both partners have never been with anyone else. So if you've got two partners that have been in a completely monogamous relationship, that's likely the only chance.
All right. Now, moving aside from HPV, smoking and weakened immune system can also bring about cervical cancer?
Yeah, think of smoking as causing free radicals. It diminishes your immune system. Any other infections that weaken your immune system, your body just has a tendency to not be able to fight off any other infections, including what causes HPV. So HPV will cause cellular changes, and if your body just inherently can't fight that off, it then just triggers a downstream effect.
How about that? Plus, I read long-term use of birth control pills. How often is that there's a noticeable correlation between that, and how long is long-term use?
We've seen a correlation with that. So anytime they do these studies, they'll take a group of cervical cancer patients, just look to see what risk factors have been there. Birth control medications have been associated with it. Now, the hard part in that is that also because of unprotected intercourse. So many women that are on birth control medications have unprotected intercourse. That seems to be the bigger correlation with HPV transmission.
All right, fair enough. Now, how about the signs and symptoms? How would a woman know if maybe she's got something going on?
I always advocate that patients know their body best. Women, men, I mean, you know your body, you know your baseline, irregular bleeding, abnormal discharge, and it's not something that just lasts a day or two or a week or so. Everyone's going to have some altered acute changes, but this is persistent. Pelvic pain, pelvic pressure, just things that are a change from your baseline where you feel like you know something's off, just go in and be seen. That's the most important thing. We always worry when women go 5 years, 10 years with all these irregular changes and just are afraid to follow up. That's where it becomes extremely problematic.
Afraid?
Very afraid, because I guess we all have that fear of what if there really is something and I don't want to deal with it. It's kind of burying your head in the sand. And I can tell you, I do the same thing also. I'd rather just deal with my other issues in life than trying to figure that out. But the right thing to do is go for those screening visits, is follow up. You know, if there's something wrong, just go be seen so we can figure out what's going on. Because the earlier we catch stuff, the easier and the better the treatment can be than dealing with something that's more advanced.
Well, and I mean, isn't it standard medical practice for women to get a pap smear on a regular basis?
Pelvic exams on a yearly basis, breast exams, mammograms on a yearly basis. Pap smear recommendations do vary a little bit, where sometimes you can space them out to 3 to 5 years, but the pelvic exams are absolutely paramount with that. But exactly like you said, like that's where the fear comes in. And it's just, well, life kind of takes over. It's been a year. You push it off. Now it's been 2 years. You push it off. Now it's been 3 years. And all of a sudden, if there are changes that are going on, abnormal changes that are going on, they just develop into further issues.
Well, in moving toward how to prevent cervical cancer, I mean, you've already addressed the sexual activity thing, which I have to imagine, given the number of people out in the world, most people aren't going to abide by that. But there is an HPV vaccine. Now, I don't want to dive into this now delicate conversation about vaccines, but how many years have they been in the market? Have they been proven to be a safe to use vaccine?
So I agree. I don't want to get into a political conversation. It's a very family-oriented conversation as well. But for us, from a medical standpoint, this vaccine has significantly proven to decrease the rates of not only cervical cancer, but penile cancer in boys also. So it is both for men and women. It's approved from the ages of 9 to 45. And to me, if there is anything that I can do, and I have 2 girls, they will both get it, to decrease their chances, I can trust my children inherently. But again, they're going to be sexually active at some point in their life. You never know who their partners have been with and what viral transmissions can be occurring. So if there is something that can be done to prevent that, absolutely, I would go for it.
Yeah, I understand that. But as long as it's been on the market, though, they've done research and there isn't a connection between the HPV vaccine and side effects or damaging things happening?
Long term, no. I mean, every vaccine has some acute side effects, such as a pain in the injection site, some rashes that can occur, just acute effects like that. But this has been on the market for decades at this point and very well proven, and especially proven to decrease the risk of high grade cervical dysplasias as well as cervical cancer.
Okay, and I understand diet can have can be a factor in cervical cancer as well.
Absolutely. So anything from and the hard part with nutrition and cancer is that anytime you read a magazine, an article, any sort of recommendations from a nutritional standpoint, everything varies dramatically. But it's all about healthy living, healthy diet. Anyone that is medical comorbidities, hypertension, diabetes, obesity, it just makes it harder for your body to fend off the cancer and tolerate the treatments for cancer. So healthy living, healthy diet, it's always going to be paramount in your treatment success.
Yeah, I've read on multiple occasions that there is a direct correlation between obesity and cancer. And given the level of obesity we have in this country, it's a little alarming. I don't know the reason why. I mean, could be the things in our food. I know RFK Jr. is going to solve that problem. RFK Jr. to the rescue, but I mean, it's a widespread problem and a growing problem.
It's an epidemic. I mean, if you look at the CDC websites as to the obesity rates back from 1970 to 2020, and you see how it spans out, I mean, it is alarming. And even for our youth of today. And so just getting out there, just starting off with healthy and just active just lifestyle choices can make such an impact when it comes to long-term care.
All right. So, sadly, someone gets a cervical cancer diagnosis. I guess my first question before we get to the treatments that are available, can that metastasize?
It can. And that's why it goes back to our previous statement as to the earlier you get seen, hopefully the earlier we are catching this. So cancer is based on 2 things. Grade is how aggressive the cancer is. Stage, has it metastasized? So we want to do that full workup, figure out exactly what we're dealing with. Cancer is more of an umbrella term. We want to know exactly what cell type we're dealing with also. There's a whole slew of workup that we'll do. So especially in the last couple of years, we can try to identify molecular markers on a patient-specific cancer to tailor their treatment to that. So we look at it as a completely overall approach when we talk about an individual's cancer care.
All right, fair enough. Now, what treatment options are available? I mean, there's so many new advancements in cancer treatments. It's hard for me to keep up with it, and I know that's your job. And every day you come to the office, there may be something new. And
that's what we have to evaluate, and that changes from patient to patient. What the type of cancer is, what the stage, what the grade are, and what those molecular markers are. So they can vary from surgery to radiation, chemotherapy, or to immunotherapy, or a combination of all of the other. We are fortunate enough to have a robust clinical trials program, so we'll look to see what clinical trials are available as well.
Well, that's exactly what I was going to ask you about next, because I was actually looking into clinical trials for the treatment of my lymphoma when last time I talked to Dr. Patel, who's treating me over there. So you always have clinical trials going on. You can address that, but also this is something that can be cured depending upon when you catch it.
Absolutely. Now and that's the goal is the earlier the stage, the greater the cure rates.
Right.
The more advanced the stage, the harder those 5-year survivals come down to. So we want to get patients in the door quickly. We want to assess them quickly and get their treatment started very quickly.
Is the cervical cancer on the rise? Or
the HPV vaccine was on the rise for a long period of time. That's why we're trying to be more proactive with the HPV vaccine and decreasing those rates. So patients that have gotten that vaccine, we've seen tremendous decrease in the rates of cervical cancer. Unfortunately, worldwide, it's just not as available.
Understood.
unprotected intercourse, multiple sexual partners. It's the fourth leading cause of cancer-related death amongst women. So,
oh my,
lung cancer.
Dr. Ajit Gubbi, it's been a real pleasure talking with you about this. And so, folks, if you want to learn more about OHC and the cancer treatments they have, any kind of cancer, or get a second opinion, I strongly encourage you to do that. It's ohcare.com, ohcare.com, and again, the number is 888. 649-4800. That's 888-649-4800. Dr. Gubbi, thanks for doing everything you do each and every day, and my best to you and everybody else over at OHC.
We appreciate it, and we're so glad you're doing so well as well.
Oh, thank you very much, sir. That means the world to me.